Hi, I'm Dr. Infantino from Platinum Wellness. I want to welcome you to this short video that the information in which has changed the lives of thousands and thousands of people. And I don't say that braggingly. It's not like I wave a magic wand and heal people, but what I'll explain today has changed the lives of people with things like thyroid conditions, type 2 diabetes, things like autoimmune diseases like Hashimoto's, thyroid problems, chronic fatigue, fibromyalgia, and even weight gain, which is probably the thing we see the most people for, which I truly believe for the majority of people is a symptom of a problem in the body. How do I know that? Well, we spend billions of dollars on diets, and what happens every year? Well, Americans are getting heavier and heavier every year. So if dieting worked, you do one once, that'd be the end of it, and you never have to worry about it again. But is that the case? Unfortunately, hardly ever, right? So what happens in our bodies? Well, for the majority of people that I see after 25 years of practice, I've learned that there's a delicate balance of hormones going on in the body all the time. And so many times people end up in fat storage mode. All right? So you have fat storage hormones and fat burning hormones. So if fat storage hormones go up, what happens? Well, let's talk about what we typically do when we go on a diet. We're doing everything we can to try to burn fat, right? We're going to exercise like crazy. We're going to maybe eat only protein. We're going to do things like count points, take fen-phen, HCG, all these things. And what do we try to do? We're trying to trigger fat-burning hormones. Now here's a problem. What if fat storage hormones have gone up? That's what we're going to talk about today a bit. See, fat storage hormones can go up from simple things like in a gut that's out of balance, from maybe drinking too much coffee, a couple rounds of antibiotics, maybe you even had as a kid. So if fat storage hormones go up, we go on a diet, we do all those things that used to work, right? Now all of a sudden what happens? Nothing happens until we eclipse fat storage hormones. Then we get to a point where all of a sudden what's happening? Okay, I'm burning some fat. Things are looking good. But boy, this is a lot of work, right? And how long could you maintain this? This is like pedal to the metal, right? I'm pushing it really hard. So maybe you can get a few weeks to a few months, and eventually what happens? Your foot falls off the gas. You're like, I can't keep this pace up. And then what? Fat storage hormones that were dominant are dominant again. I have patients come in like, Doc, I just look at food and I gain weight. Why? Well, because we never addressed the fat storage component. And so our approach in the office is pretty simple. Let's at least make sure we get this balanced. Now, I'll talk a little bit about on this video, how do we get those things balanced? But again, stress is a huge one. Stress from too much cortisol will produce cortisol in the system. Cortisol is a fat storage hormone. A gut that's out of balance will cause your pancreas to make too much insulin. Things like toxins in the environment, I'll explain a little bit about also. These are all things that increase fat storage hormones. Because let's face it, what do we all do when it doesn't work? We go, man, if I'd have done what I did 20 years ago, I'd have lost weight like crazy. So what do we blame it on? We say what? I'm getting older, it must be my metabolism, right? Well, sometimes it's a metabolism. I wouldn't say your metabolism is quite as charged up at 70 as it is back at 20, but it doesn't account for the majority of people's weight gain. In fact, look around the country, watch the news some days in other countries around the world, and what do you notice? You see people in like Japan and other places in their 70s and 80s, are they all overweight? No, 75% of Americans are. It's not just because we're older. And I always ask people, why do you think we all got so heavy? Well, a lot of factors, but our environment was one of the biggest ones. And when I say environment, I mean things like toxins. Do you realize that the average American eats 9 pounds of chemical additives in their food every year? 9 pounds. I mean, that's insane. So the EPA actually says that the average American has 400 to 800 toxins sitting in a fat cell. Now, can you imagine the effect 400 to 800 toxins would have on your body? So here's what happens. We go on some type of diet and we try to lose weight. Now here's your fat cell, but it's got these toxins in it. Most diets do what? They pull fat out of the fat cell. Makes sense. But what's getting left behind? All these toxins. They get more and more concentrated. Now your body's pretty smart. It says, hey, does that cell happy if it's concentrated and full of toxins? No. So what does it do? Well, it's called the rebound effect. What your body will do is actually increase fat storage hormones and say, hey, let's dilute this. Let's put more fat back in this fat cell. This is why the same 1,000 calories that used to work, now your body with that 1,000 calories says, I don't think so. I've still got to get some fat in there to protect me from this stuff. Does that make sense? So gut health is one of the things that's almost always overlooked. So here's what happens. We put into our bodies things from a box, a bag, a can. Then we add to that things like antibiotics, etc. And what happens? All this stuff goes where? Into our mouths. And then eventually it ends up in our stomachs. And then down into our gut at some point. So, as this stuff heads down into the stomach, it has one effect in particular, decreases the acidity of the stomach over time. So inside your gut, what do you have? You have a whole bunch of little villi. And these villi are home to about 100 trillion bacteria. Now those bacteria outnumber the cells in our body like 10 to 1. So they are super important. How did the bacteria get there in the first place? Well, most of them got there through just being breastfed and going through the birth canal. Now, what percentage of the population was breastfed 12 or more months and went through the birth canal? I've read as low as 2% in some studies. So a lot of us never got these guys in the first place, and I'm going to explain in a minute why that's so important. So the food goes in, the stomach acidity decreases. Now, your stomach tries to digest the food, but if it's less acidic, what happens? The stomach's sitting there and it's going, trying to digest, and eventually it says, hey, look, I've got to get this stuff out. But there's a valve right here, and this valve looks at the food and goes, you know what? It's not done. It's not digested. So what does the valve do? It snaps shut. And it says, I'm not letting you out. Well, the stomach's like, hey, I got to contract. This food's got to keep going. So it contracts. Now, this valve is going to close up too. So now we got valves at the top and the bottom both closing. How does that feel if your stomach contracts and two valves are closed? You ever have indigestion? Like, ooh, that just didn't agree with me? Exactly. What happens next, though? Well, that food, since this valve is weaker, goes where? Back up. And what do we call it when the food heads back up? Acid reflux. And how much do we spend on acid reflux drugs these days? Billions of dollars, right? To do what? To decrease the acidity in the stomach even more, which is going to really exacerbate what I'm about to explain. Eventually, this valve opens up, and this not very well digested, not nearly acidic enough mess heads downstream. And what does it do? It affects these guys. Those 100 trillion bacteria living on these little hair-like fibers. And the reason those hairs are there to increase surface area. So your gut, if you opened it up, is about the square footage of a tennis court. Can you imagine that? Now, over time, you could wipe these guys out. But first, let's explain why the bacteria are there in the first place. They have some really important roles. One, they digest food. Two, they make B vitamins. And what do B vitamins give us? Exactly, energy. Remember I said before, fatigue, the #1 reason people go to doctors? What else do? They decrease blood pressure, they decrease blood sugar. They have a lot of important roles. But over time, these guys get wiped away. The bacteria aren't there. Who takes over if the bacteria aren't there? Bad guys. Bad bacteria, yeast, you might have heard the term candida. What effect does that have on the system? Well, the food is now heading downstream, but it's not completely digested. So as the undigested food heads downstream, what happens next? The pancreas is sitting here and says, hey, wait a second, I'm going to have to help out. So what does a pancreas normally secrete? Some insulin, right? When it sees this undigested mess coming at it, what does it do? So now your pancreas is pumping out what? Insulin. What's the problem with that? Well, one problem is insulin is a powerful fat storage hormone. So if your gut's out of balance, your hormones are going to lead you more towards fat storage. This is why you ever notice two people can eat the same amount of calories, one gains weight, one loses weight, one nothing happens. This is what's going on internally. So undigested foods heading downstream. How does this person feel when this gets really bad? Kind of gassy, bloaty, right? If the food's not digested, it's rotting literally. So this person doesn't feel very good. They might have a little reflux. Now, what happens? Well, this food that's undigested is still going to head further downstream. And by the way, would you say this is probably relatively stressful to the body? Of course it is. So what does your body do when it's stressed out? It secretes another hormone called what? Cortisol. And what is cortisol? Another fat storage hormone. By the way, what disease process are we creating if insulin is constantly high in the body? Cells become something called insulin resistance, and that's our glucophage and metformin, the drugs that seems like everybody's on these days. So as insulin resistance increases, now what? Now we're storing fat, gaining weight, becoming what? Yeah, diabetic, slowly but surely. So here's what people will tell me. They'll say, Doc, you don't understand. I'm good, I don't eat like this anymore. But again, if the damage is done, when this person eats really healthy food, a lot of times what happens is they feel more gassy and bloated than before. Why? Because if you don't have the healthy bacteria to digest the food, you end up with more gastric problems. I can't tell you how many people come into me and say, I tried eating healthy, it just didn't work. Others are eating healthy and going, why am I not getting the benefit from eating healthy anymore? So this undigested food keeps heading downstream. Where does the food have to get to eventually? Eventually it's got to get into what? Your bloodstream. Now, it's going through just a little set of cells to get into your blood. But if it's too big and it's not digested properly, what happens? Food literally will leak into the bloodstream. You might have heard the term leaky gut syndrome. It is like all the rage these days. So now we've got chunks of food in the blood. Does your body like chunks of food in the blood? Of course not. So what does your body do? It activates what? Your immune system to attack who? Well, if your immune system's attacking what's in you, that's what? Autoimmune disease. How about allergies? Would you say allergies these days are going up or down? Hey, when I grew up, I don't want to age myself here, but I've never had a friend who could die from eating a peanut. I have 4 kids. There's not an event we go to that there isn't an email that says this is a nut-free event or a gluten-free event or whatever the case may be. Why? Because if the immune system's already attacking things, anything else that adds to it, the body goes, whoa, time out, I can't handle that. Now, how might you know if you have this going on? I'm going to list a few symptoms of a gut that's like this. And, I would suggest just keep track at home. Count on your fingers. If you run out of fingers, odds are you've got this imbalance. So we've got things like allergies, congestion, hives, diarrhea, weakness, cramps, irritability, migraines, increased sensitivity to food, gas, bloating, heartburn, constipation, like less than 2 well-formed bowel movements a day, spastic colon, like, hey, I got to find a bathroom, frequent sore throats, 1 or 2 a year is frequent. Sinus infections are a big one. Yeast infections, obviously. Rash, anxiety, frequent urination, bladder, bedwetting, night leg pains, irritability, moodiness, restlessness, panic attacks, sleep disturbance, short-term memory, inability to concentrate, fuzzy thinking, confusion. You walk in a room, you're like, why am I here again? Or you're reading a paragraph, you're like, I just read that 3 times and I still have no idea what it said. And they're all linked. And this is why we find ourselves fatigued with achy joints, a few sinus infections here and there, can't remember anything, and we go, it's just old age. It's not old age. Now, all those symptoms, can they only be caused by this? Of course not. You can get headaches from being dehydrated. But if you saw a trend, odds are pretty good that there might be something going on that you might want to have checked out. And that's why we do an assessment to figure out if in fact this is going on. You could take a medication for any one of these. This is going to cause weight gain, so you could take diet pills, you could count points, you could do all the things I mentioned before, or you could figure out what's causing the problem, right? So our approach is pretty straightforward. What we want to do is get these guys back if they're missing. Well, first thing we want to do is we want to know what's going on. Is your thyroid a problem? And we talked about that a little bit before. Is there an imbalance in adrenals? Most people are go, go, go so much their adrenals are fatigued. So we screen for that. We want to know if the gut's working properly. Once you know by doing an assessment, which you'll have an opportunity to if you like at the end of this video, then we could sit down and talk about, all right, where do we go from here? Right? Then we customize a game plan of doing what? Well, rebuilding and restoring health. See, most people think if you go on a diet, you'll get healthy. You lose weight, get healthy. I think we've got that backwards. I think honestly, if you work on getting healthy, a side effect of that is you'll lose weight. And instead of dieting over and over and over, you do it once the right way the first time. So what is our approach to clean and rebalance, reboot the whole body? Well, a foundation of that is food, right? So just clean, healthy food. That's pretty simple. Most people can Google that and understand it. Predominantly, we use a lot of vegetables, lean proteins. That creates a foundation by which supplements can really get the job done. The supplements we use are all grown organically. They're designed specifically for cleansing and detoxing the liver, the kidneys, the colon. Cellulite, for instance, helps shrink that. Because what is cellulite really? It's not fat. It's a toxic body condition. That's why we use things like body wraps that are developed by a biochemist at UCLA to literally restore flow and increase circulation so we can get some of the sludge out. People will lose inches like dramatically by doing body wraps. We don't use them just to lose inches though. We use them to get toxins out. We use things like whole body vibration, which pump the lymphatic system clean. We use things like saunas, which a far infrared sauna will penetrate about 1 inch to 2 inches under the skin and pull toxins out of fat cells, stimulate the immune system. You'll burn about 600 calories in a half an hour. These are all modalities that help speed this process up. So then when you dump those toxins into the blood, into the lymphatic system of the bloodstream, now we have the right nutrition that can bind and eliminate it. We don't have any little purple pills. We don't have any prepackaged meals. It's just normal, healthy food. And you learn how to eat that way and like it for life. And that's the key to the whole thing. I grew up in a big Italian family. And my family, I think I can honestly say, every aunt, uncle, grandparents, they all died of heart disease, diabetes, and all pretty young. I remember watching my mom go through the same exact thing. She was on a diet my entire childhood. And it was heartbreaking because she was taking care of my grandmother. Now my grandmother had diabetes. And You know, I remember when they cut her toes off, and then they cut her off at the ankles because of lack of circulation, and then they cut her off at the knees. And you know, my only memory of my grandmother, quite honestly, is what? You know, it was a blue wheelchair with 2 white bandaged up stumps. And I think the hardest part was to watch my mom deal with all that and take her from doctor to doctor. Meanwhile, she was dealing with the same exact health challenges. And she'd be like, I'm on a diet again. And she worked it so hard. And you get to the point where she's eating less and trying to exercise more and getting fatigued. And this is what she had going on. And so she's struggling and struggling. I know there's so many people out there just like her that are going, I'm doing everything I know how. Now, she had all the reason in the world to get this kicked over, right, and get these new healthy habits, but still even eating right wasn't enough. And she's watching my grandmother literally die over the period of about 10 years. It was horrible. And still felt like there's nothing she could do to make any real change because she tried everything she knew until we started doing this type of work. So, what's the first step? Give us a call. The phone number is right there on the screen, or go online and check us out. Fill out the assessment. It'll give us a whole report of what's going on in your body. We'll sit down, we'll go over it together. If anything resonates with you in this video and you'd really like to know more, start there. I'll give you my 2 cents as far as where we can go from here, and you can decide. Have a wonderful day.